Hello, my name is Destiny Jones, and I'm going to be talking about the pelvic inflammatory disease. I chose this disease because I think it's very important to learn more about our pelvics and what's going on in our cervix, especially for us young women who are either active or just it's just important to learn with us young women or any other age women. Number one, about the disease. About the disease, affection of the female organs, inflammation in the female genital tract. The disease spreads when a sexually transmitted bacteria spread from your vagina to your uterus, fallopian tube, or ovaries, or it comes with a fever and lower abdominal pain. Some symptoms include pain while peeing, pain around the pelvis or lower stomach, discomfort or pain during sex that's felt deep in the pelvis, or lower back pain. What are the signs and symptoms? Signs and symptoms include pain in lower abdomen. This is the most common symptom. A fever with 100.4 degrees Fahrenheit or higher. Vaginal discharge that may smell foul. Painful sex. Pain when urinating. Irregular menstrual cycles. Or pain in the upper right abdomen. This is rare. How do I get PID? You are more likely to get PID if you have an STD and do not get treated, have more than one sex partner, have a sex partner who has sex partners other than you, have had PID before, are sexually active and are age 25 or younger, or DUCHE. And PID is short for pelvic inflammatory disease. If you don't feel like saying all that, you just shorten it to PID. How can I prevent PID? Use condoms. It will decrease your chances of getting anything. Get tested for STDs or any sexual transmitted disease. Be monogamous with your sex life or limit your number of sex partners. Having more than one sexual partner is increasing your chances even more. Number two, diagnosis. How is PID diagnosed? You have abscess in a fallopian tube or ovary. You are pregnant. Your symptoms do not go away after taking the antibiotics or if you cannot swallow pills. If this is the case, you will need IV antibiotics. You are very sick. Possible causes: sexually transmitted disease, chlamydia, gonorrhea, or mycoplasma genitalium. Primary prevention method. This involves avoiding any type of acquisition of sexually transmitted infections. You can also get into counseling and patient education to learn more about the usual diagnosis and treatment. Delaying sexual activity until the age of 16. Secondary prevention method. Avoiding a lower genital tract infection from increasing to the upper genital tract. Screening for infections in high-risk population, or rapid diagnosis and effective treatment of STDs and UTIs. Tertiary prevention method: early intervention and completed treatment, preventing the upper genital tract infection from leading to the tubal dysfunction/obstruction, so it won't interact with the functional or structural damage to the other abdominal/pelvic organs. And here's a picture showing what type of pain you will go through in your pelvis or cervix. This disease is very painful, and I wouldn't wish that on anybody to get. So it's very important that you are safe as much as possible. Number 4, pathology. Ways of contagion: gonorrhea, caused by the infection with the Neisseria gonorrhea bacterium. Condoms: it is important to use condoms to eliminate your odds of getting this disease. Chlamydia, sexual disease that is spread through sex or contact with genital fluid such as semen or vaginal fluid. PID bacteria. Bacteria can enter your reproductive tract anytime when the cervix are disturbed. Here's a retrospective analysis reason, and this is reasons for hospital admissions of patients. The symptom is pain. Degree of the pain is 8, percentage 14.2. Fever and pain, the pain is 16, percentage 28.5. Fever plus pain plus leukorrhea. I don't know if I said that right. The degree pain of that is 30, percentage is 53.5. Pain plus bleeding, pain is 2, percentage is 3.5. The total of the pain will be 56, and the percentage total is 100. There's a total of 750,000 cases in the world of PID. 66% is less than 25 years of age, and 33% is 30 years or older. Number 5, treatment. Treatment effectiveness, 40% use pills. It is usually treated with antibiotics to provide empiric broad spectrum coverage of most pathogens, and 84% uses injections. The ceftriaxone infection is used to treat certain infections that are caused in our bacteria. Intramuscular/oral treatment. Recommended intramuscular/oral regimens. The ceftriaxone is 25 milligrams in a single dose plus ceftriaxone, if I'm saying these wrong, I'm sorry, 2.g IM in a single dose, and probenecide 1 gram orally administered. Doxylin is 100 milligrams orally twice a day for 14 days. And metronidazole is 500 milligrams orally twice a day for 14 days. And cephalosporin, again, I'm sorry if I'm saying these wrong, is 500 milligrams orally twice a day for 14 days. And that is the end of my presentation. I hope that you liked it and you learned more about the pelvic inflammatory disease. At the end, I'm going to put together some TikTok videos so you can learn more. And yes, thank you so much, and have a good holiday, and Merry Christmas, and thank you.
7 symptoms of PID. Number 1, painful wongoro. If you're among the people that love to wongoro like myself and you enjoy the wongoring process, all of a sudden it's no longer enjoyable, it's painful, please go and get checked in the hospital. Number 2 is lower abdominal pain. So you have this continuous lower abdominal pain from time to time. That is pointing to possibility that you have pelvic inflammatory diseases. Number 3 is intermittent uterine bleed. You know your cycle length, but now it doesn't follow the step any longer. You see your period on the 1st of July. You're seeing it again on the 12th of July. That is not right. You need to go and get checked in the hospital. Number 4, offensive smell coming out from your VJJ. We need to call a round table for this one, because some people will notice offensive smell. They will go and use perfume to spray. That is not the right thing to do when you notice that your VJJ has an offensive smell. Please, if you notice it, go and get checked in the hospital. Number 5 on my list is colorful discharge. We don't produce colors down there. We don't produce Danish yellow and greenish blue. When you start seeing discharge like yellowish discharge or greenish discharge coming out from your VJJ, please go and get it checked. Now, this last 2 that I'm going to be mentioning is actually very dangerous if it gets to that point, which is increased body temperature. When your body temperature has increased, it is not always malaria and typhoid, especially if you're a lady. It could be related to your reproductive system. When you have noticed any of the symptoms I've mentioned above, and now you are having running temperature or an increase in temperature, please, my sister, carry your bag, leave whatever you're doing, and visit the hospital. Number 7 on the list is fever. So, like I said before, that your running temperature does not always mean you have malaria and typhoid. Now you're shivering on your bed, you're feeling cold and you're feeling warm at the same time, and you are now feeling sick as well. Please go to the hospital and get checked. I am your celebrity sonographer. I will see you in my next video.
Inflammatory disease is an infection of the woman's reproductive organs. It is caused by a bacterial infection that can spread to your uterus, ovaries, or fallopian tubes. This is often caused by sexually transmitted infections such as chlamydia or gonorrhea, but there is also an increased risk of infection after an abortion or insertion of an IUD. Watch part 2.